I would like to talk about the epidemic.
First and foremost, that's why Professor Sophia Chan, Secretary for Food and Health, is here with me. Now, I would like to talk about a community cluster of infection cases. This cluster so far involves 9 confirmed cases, possibly. I have to stress confirmed and who is unfortunately still in a critical condition. That's the lady, and then her husband. Now, usually in such infection cases, it's about close contact of family members. So the first 2 in the cluster, and then there are 2 colleagues working in the same warehouse as the first patient, but of course we don't know yet who were the first to be infected. We still have to find out, but then anyway, there are 2 other colleagues working in the warehouse. And so this is infection at the workplace. And then last night at the building where the lady lives, that is Luk Chun House of the Luk Chun Estate, so far we have done over 1,000 tests, and 4 residents in the building have been confirmed or tested positive. Now, Professor Yin Kwok Yong and our colleagues visited the building. The initial conclusion that it's not to do with the building structure that's led to the risk is possible. So therefore, there is environmental contamination and infection as a result. And then the 4th patient is colleague of the Fire Services Department. Now, he sent the first patient to the hospital. It's suspected that he could have gotten infected. So it's the first time that we have a healthcare worker who is infected at work, because for the other earlier case, it's not yet confirmed whether that colleague was infected at the airport, and she's from the Department of Health. So we are highly concerned about this case. It's not just because of the number. As I said, so far for this cluster, there are 9 confirmed cases, but rather in this cluster, there are various elements that are cause of concern. For example, the workplace element and possible infection for people going in and out of a building. So that's why we're carrying out a series of investigation. And later on, I will invite Professor Sophia Chow to tell you a bit more. And as you know, about a few weeks ago, we went into the lift phase of the suppress and lift strategy. So for business premises that were closed, they reopening now. But of course, as they do so, they have to take various precautionary measures, but still many of them are able to do their business. And starting from this week, there is a series of anti-epidemic measures that will expire, including this week on the 4th of June midnight. Regulated eating establishments and business premises under Cap 599F, and also the gathering restrictions of no more than 8 persons under Cap 599G. All these measures will expire upon the expiry of the 14-day period. And then there are also 2 regulations on the restrictions on and quarantine measures for people arriving at Hong Kong from the mainland Hong Kong, Taiwan and Japan. That's Cap 599C. And then there are others coming from other places under Cap 599E. There are various requirements as well. So on the 7th and 18th of June this month, these various regulations will expire. So we will need to make an early announcement to the public as soon as possible. As I said, we will make an early announcement, but with this new community cluster, which is causing much concern, we will be very cautious, because as you might recall, in this whole fight against the epidemic, I always mention 3 broad principles. One is that we must stay highly alert and prepared, and the second is that we must respond swiftly. So That's why later on we may be announcing a relatively more stringent attitude towards these measures. Now I will invite Professor Chen to say a few words on follow-up action, and then I will come back to talk about other issues.
Thank you, Chief Executive. Friends of